Hello, dear students. Myself, Mushtaq, Senior Lecturer, MC Society's Institute of Pharmacy, Azam Campus. In this lecture, we are going to learn about definition and introduction of pharmacology. Outcome of this lecture: number one, the student will be able to define the term pharmacy, pharmacology, and toxicology. The student will be able to define various terms used in pharmacology and toxicology. In the previous lecture, we have learned that drug is a substance that will change the abnormal physiology to normal, and it is used for diagnosis, prevention of or cure of disease. That means we learned that a drug will is a substance that can change our body functioning. It is intended that it will change the body functioning. Now, first we have to identify the substance. Commonly, we called it as drug. After that, we have to select the part and we have to store or preserve it. We have to standardize it. Then we have to compound and dispense that product, which brings our abnormal physiology to normal. So all these things are learned in pharmacy. That is the science of identification, selection, preservation, standardization, compounding, and dispensing of medicinal substances or drugs. The term pharmacology, it is derived from two Greek words. Pharmakon means a drug and logos means science. That pharmacology is the science of drugs. Pharmacology consists of a detailed study of drugs, particularly their action on living animals, organs, tissues, etc. The action may be beneficial or harmful. In short, pharmacology is a science in which effect of drug is studied on the living body. But we will not study all the aspects of drug in pharmacology. Mainly we will study effects of drug on living body. So in another sense, the study of interaction between drug and biological system is called as pharmacology. It includes history, source, biochemical and physiological effects, mechanism of actions, therapeutic uses of drugs. The second term, that is pharmacokinetics. It includes the study of absorption, distribution, metabolism, and excretion of drug. We have already learned drugs are substance which brings abnormal physiology to normal. That means that substance should enter in our body, it should get absorbed from our body and distributed in our body, get metabolized, and it should be excreted. That means from entry of drug into body until its excretion, the study of what happens to drug in the body is known as pharmacokinetics. So from dosage regimen like tablets, capsules, syrups, etc., there will be disintegration of tablet in the stomach. From stomach and small intestine, the drug will get absorbed into blood circulation and then get distributed in our body through blood, and then it get to the site of action, show its effect, After that, it should get metabolized and excreted from the body. So what the body does to the drug, that is absorption, distribution, metabolism and excretion, is called as pharmacokinetics. Pharmacodynamics. It includes the study of mechanism of action and pharmacological effects of drug, that is the study of how drugs affect the body. That means we will came to know what the body will be affected by the drug, like it will change the blood pressure, or it changes the heartbeat, or it will change the acid content of stomach. Means what happened to body due to the drug is studied under pharmacodynamics. It's also elucidate the mechanism of action of drugs. Therapeutics. In Greek, it means art of medicine. That means the steps which is taken in treatment of disease. Therapeutics means to care for, to tend, or to nurse. So it is a branch of medicine concerned with the cure of disease or relief of symptoms. And the therapeutics has many branches like physiotherapy, psychotherapy, radiotherapy. In the same way, or drug therapy, that is called pharmacotherapy, in which we utilizes drugs in the treatment of disease. Like in physiotherapy, the therapist will perform various exercises in the treatment of disease. So in pharmacotherapy, we use drugs in the treatment of disease. That is the study of drugs in relation to their application in the treatment of disease is known as pharmacotherapeutics. The application of pharmacological information together with the knowledge of disease for its prevention, mitigation or cure. So by the pharmacotherapeutics knowledge, we will able to select most appropriate drug, dosage and duration of treatment such that it will benefit the patients to get relief or cure from disease. Therapeutic index. Therapeutic index will shows the margin of safety a drug will possess. It is obtained by taking two types of dosages. First is LD50 is the dose of drug that will kill 50% of total animals in the study. Next is ED50, that is also called as effective dose, is the dose required to produce desired effect in 50% of total animals. So by taking these two doses, we will get the therapeutic index, which is the ratio of median toxic and effective doses, that is LD50 by ED50. The therapeutic index indicates safety and margin of drugs which is should be increased, which gives much window to use the drug. Second one, it expresses potency or toxicity of drugs, how effective or toxic is the drug. Third one, it will reflect benefit and risk ratio of drugs. So it is very important to obtain the therapeutic index of drugs. If there is increased therapeutic index, there is increased safety of margin of drugs, means a large dose of drug will be safer and will not produce much risk to the patient. Next, poisons are substances that cause harmful, dangerous, or fatal symptoms in animals and human beings. And many drugs in large doses act as poisons. They will show harmful or fatal symptoms in human beings as well as animals. So toxicology is the science in which effects of poisons is studied on the living body. It is the study of action of various doses of drugs. Means if there is an overdose or low dose, what will be the effect which may endanger life. It is a study of poisons, it affects and treatment for it. The poisons may be from household, environmental pollutants, industrial, agricultural, homicidal, and in toxicology we emphasis on detection, prevention and treatment of poisoning. And the last is clinical pharmacy. In clinical pharmacy involves cooperation of the pharmacist with the physician in educating the patient about compliance and counseling him on how to take the medication and monitoring the errors in taking the drugs. So by the knowledge of drugs, the pharmacist will help the physician and the patients such that the treatment will be safe to the patient. So what we have learned in this lecture: number one, pharmacy is the science of identification, selection, standardization, compounding and dispensing of drugs. Pharmacology is the branch of science which deals with the study of effects of drug. And other terms which we have learned in this lecture are pharmacokinetics, that is absorption, distribution, metabolism, excretion of drug is studied. Second, pharmacodynamics, which studies the mechanism of action, pharmacological effects of drugs in the human body. Pharmacotherapeutics, that is application of drug knowledge in the treatment of disease. Poisons are called as substances which causes harmful or fatal uh, symptoms in human body, and we know that many times drugs may act as poisons, especially when given overdoses of the drug. Second, we have learned that study of poisonous effect on the human body is called as toxicology. And the last, clinical pharmacy is cooperation of the pharmacist to the physician in educating and treatment of patient. Thanks a lot.